Most athletes with REDS, or relative energy deficiency in sport, think that recovery means getting slower. No, it doesn't. In fact, the right recovery plan is what allows you to perform at your best again. So the mistake is believing that eating more and training less is the whole answer here, and it isn't. So today I'm going to show you how to recover from REDS while protecting your fitness that you've worked so hard to build. Now, by the end of this video, you'll know whether you're making the one recovery mistake that's keeping your hormones suppressed. So this is the tension that every athlete with REDS faces. This condition developed, at least in part, because of a strong commitment to training. Pulling back, reducing training load, changing your dietary approach, watching performance metrics shift in the short term, all that can feel like you're moving in the wrong direction. But I want to reframe that directly. You're not losing ground when you are working to recover from REDS. You're creating the physiological conditions that allow the training you've already done to produce the adaptation it was supposed to produce all along. But what's been missing is the hormonal and energetic environment to realize it. Recovery from REDS is not stepping back from performance. It's the prerequisite for returning to it. Hey, I'm Dr. Jason Barker. I'm a naturopathic doctor, two-time Ironman finisher, and lifelong endurance athlete, and 20 plus years working with endurance athletes. So let's go through exactly what this all looks like. First off, we need to close the energy gap. Everything depends on this. The energy gap is the upstream driver of every downstream consequence we've covered. Hormonal suppression, recovery deficit, bone remodeling disruption, immune compromise. None of those resolve while that energy gap remains open. Supplementation, training adjustments, sleep optimization, all of these support your recovery, but none are a substitute for closing that energy gap first. The target energy availability for recovery is above 45 kilocalories per kilogram of lean body mass per day. That's the research-supported threshold for normal hormonal function. Many REDS athletes are operating around 20 to 30 and sometimes lower when they're actually identified and diagnosed. Getting from there to above 45 represents a meaningful increase that often feels uncomfortable initially. But the body's first priority when energy availability is restored is to fund the systems that have been rationed. And in athletes with sufficient training stimulus already accumulated, performance improvements can come surprisingly quickly once that environment has been restored. Okay, carbohydrates are a hormonal intervention here, not just a fuel. So total caloric increase is absolutely necessary, but carbohydrates deserve specific attention. So in the REDS context, chronically low carbohydrate intake is one of the most consistent drivers of cortisol elevation, because when blood glucose is insufficient, cortisol is working to drive gluconeogenesis to compete, getting your blood sugar up. That's the first domino in the entire cascade. I covered that back in video 2 of this series. Now, restoring adequate carbohydrate intake doesn't just provide training fuel, it directly reduces the cortisol signal that's been suppressing testosterone, impairing thyroid conversion, and driving the hormonal environment towards catabolism. Carbohydrates in this context are a hormonal intervention. So for most endurance athletes, that means 5 to 7 grams per kilogram of body weight on moderate training days and more so on heavier days. Those numbers feel large to athletes who have been restricting their diet, but they're what the physiology absolutely requires here. Okay, next up is protein. This is the repair substrate. Protein needs to be sufficient for elevated tissue repair demand because the repair deficit has been accumulating over the entire period of energy insufficiency. Now, I use 1.6 to 2.2 grams per kilogram of body weight daily, or 0.7 to 1 gram per pound of body weight daily, and more so toward the higher end during active recovery. Protein distribution across meals matters as much as daily total, aiming for 30 to 40 grams per meal, with sufficient leucine content to trigger the mTOR signaling pathway for muscle protein synthesis. Concentrating protein in 1 or 2 meals, regardless of daily total, is significantly less effective than distributing it out through the day. Okay, let's talk timing. When you eat matters here. So there's 2 timing points that are specifically relevant in REDS recovery. So post-training nutrition within 30 to 60 minutes, carbohydrates and protein combined here, is when the body is most receptive to glycogen replenishment and muscle protein synthesis in cases of REDS. Now, athletes who delay post-training eating, they're extending the energy insufficiency window that follows every session. This is a meaningful lever that costs you nothing to change. Pre-training nutrition also matters here. If you train in a significantly fasted state, this is going to be very effective at raising your cortisol. So in an athlete already dealing with elevated cortisol from REDS, fasted training compounds the hormonal suppression that's been driving this condition all along. So you need to really ensure your carbohydrate availability before your exercise sessions, particularly the longer or high intensity ones. This is going to reduce that cortisol stimulus very directly. Now, you also need to reduce training load. Why this is required and not optional here. This is the part that most athletes resist, but the physiology here is also very direct. In REDS, the recovery side has been inadequately funded. Training has been creating stress without producing the proportionate adaptation. Adding more stimulus to that situation doesn't accelerate the progress here. Instead, it just widens the gap. So the specific reduction depends on where that athlete is in the REDS spectrum. So mild to moderate REDS may require a 20 to 30% reduction with specific attention to your intensity, as an example. More advanced REDS with significant hormonal suppression or bone involvement may require even more substantial reduction. What I try to protect during load reduction is aerobic base, the most metabolically expensive component to rebuild essentially. In practice, that means maintaining lower intensity aerobic work while significantly reducing high intensity sessions, which carry the highest cortisol cost and recovery demand. Now, of course, this is going to be temporary. As energy availability is restored and hormonal markers normalize, training load rebuilds systemically as well. So those athletes who accept the early phase of load reduction return to full training and exceed those previous benchmarks much faster than those who try to maintain full load while addressing only the nutritional side of this. Okay, let's talk about sleep. This is the nightly hormonal restoration window. Testosterone production, growth hormone secretion, cortisol recalibration, these all happen primarily during deep, slow wave sleep. In REDS recovery, sleep is part of the treatment protocol. It's not just a lifestyle recommendation here. Practical targets during active recovery are anywhere from 8 to 9 hours of sleep opportunity per night. Consistent sleep and wake times to anchor the circadian rhythm. No high intensity training within 3 hours of bedtime at least. This will elevate cortisol and delay the nervous system downshift that initiates deep sleep. And specific attention to the sleep disruption that REDS itself produces through progesterone and testosterone suppression, which we covered in detail in the earlier videos in this series. Okay, let's talk about return to training in the 3 phases. So the most common mistake in REDS recovery is advancing that return to training based on symptom improvement rather than lab normalization. Symptoms will frequently improve before hormonal markers fully normalize, and premature load increases in training at that point are the most consistent cause of incomplete recovery and relapse. So phase 1 is stabilization. Reducing load, restoring energy availability, and the hormonal markers are going to begin to normalize here. This phase ends when key lab markers have reached performance range levels, not when the athlete feels better themselves physically. Now, phase 2 is progressive reloading. Systemic increases of roughly 10% in total load per week with regular monitoring of resting heart rate variability, and of course, subjective recovery. Any meaningful uptick in fatigue or performance plateauing during this phase is a signal to pause, not to push through. Now, phase 3 is return to full training and performance development, which begins only when energy availability has been consistently maintained, when those hormonal markers are stable across at least 2 consecutive testing intervals, and progressive reloading has been well tolerated. All right, let's talk some realistic timelines here. So with mild REDS, caught early without significant hormonal suppression or bone involvement, can show meaningful improvement within 4 to 8 weeks, depending on the individual. Hormonal markers often begin normalizing within about 2 to 3 months. If you have moderate REDS with measurable hormonal suppression and a longer duration of energy insufficiency, this typically requires at least 3 to 6 months before those hormonal markers are stable and full training can resume. Severe REDS with significant bone density loss or prolonged hormonal suppression can require 6 to 12 months or longer in certain cases. So the reason these timelines aren't negotiable is the same reason we covered in the mechanism video in this series. The body made real physiological adaptations during the period of energy insufficiency. Metabolic rate was recalibrated, hormonal set points were shifted, and bone remodeling was disrupted. Those adaptations unwind on a biological timeline that attempting to compress consistently extends the overall recovery period rather than shortening it. All right, let's talk monitoring. How do you know this is working? So recovery from REDS shouldn't be managed by feel all alone. The markers that identified the condition need to track through recovery to confirm the intervention is working and guide return to training decisions as well. So to bring it all together, recovering from REDS without losing fitness means closing the energy gap first, with specific attention to carbohydrates as a hormonal intervention here and protein distributed across meals throughout the day for that repair support. It means an honest and temporary reduction in training load that protects your aerobic base. It means treating sleep as a clinical intervention here, not a lifestyle suggestion. And it means following a phased return to training approach guided by lab markers rather than your symptoms, how you're feeling. The timeline here is very real, but athletes who commit to the full recovery process consistently return to performance levels that exceed where they were because, for the first time in however long the energy gap has been open, their body finally has what it needs to convert training into adaptation. That's the point of this entire series here. Not to just identify REDS, but it's to get back to performing. Please hit like and subscribe. I post science-backed content for athletes at every stage and level. And for individualized REDS evaluation, testing, and a structured return to performance protocol, please visit naturalathleteclinic.com. I'm Dr. Jason Barker. Thanks for watching, and I'll see you in the next one.